We are here to discuss the crisis mode questions for pet parents who are currently in crisis mode with their pets after a reaction to the drug on the market as Librela, also known as Beransa for dogs, and Solensia for cats. For the ease of discussion, we will use the term Librela to mean both Librela and Solensia, because the reported effects upon both cats and dogs are so similar. And a couple of brief introductions of who is talking today. Myself first as the interviewer. My name is Rhonda Straub. I am here at the request of the team at Pet Advocare as a representative of pet parents, because much to my sorrow and regret, I am one of them. I lived through all of this firsthand, so I endeavor to be a proper representative for that group today. And with me is Dr. Josie Boog, Doctor of Veterinary Medicine, and I'm actually not familiar with what the letters CVA are for.
It means Certified Veterinary Acupuncturist.
I'm going to point out a very big reason why you specifically are the doctor we're discussing this with today. Because you are the author of a publication that you entitled Librela, How to Evaluate New Pharmaceuticals and Medical Products, which was dated December 8th of 2023. That document became basically the gold standard and the only one that those of us who went through this early on when this product first hit the market in the US, yours was the only document we had to refer to and to use as discussions with our veterinarians about what was really happening with this drug. That document is a proper due diligence of this medication that I feel most pet parents believe that all of our veterinarians would conduct. But nonetheless, your publication was the one we had available to us, and for a long time, the only one. So thank you so much for accepting our invitation to have this conversation today.
Oh, well, thank you, Rhonda. I have really mixed feelings about that, because I feel like all veterinarians should do that due diligence, and they didn't. And I was really surprised that I was like one of the first and only ones to really step forward on this issue. So thank you. And I'm glad I could put it out there, and be of service to people. Really.
It's been of tremendous service. So thank you for dedicating your time today to have this conversation to further help these pets and pet parents, because as long as this drug is in the market, the number of those is not going to decline. And so we're going to try and keep this conversation narrowed to our top 10 questions that the pet parents have when they enter into this experience and their pet has had an adverse reaction. Those include, first, how are pet parents connecting the dots? And the first question is what I'm seeing happening to my pet, could this be from the Librela? Next is there a way to detox from this? Then, is it safe to give other medications or pain relievers? What can I do to support my pet at home? What supplements or over-the-counter pain relievers should I consider? Anorexia is a huge issue. How do I get my pet to eat? My pet has extreme weight loss and muscle waste. What can I do? Is this survivable, or will there be permanent damage? How do I talk to my vet about this? And other treatments I can consider for my pet's osteoarthritis. The first one, connecting the dots. Most of our pet parents, they haven't been informed that there even are side effects, much less what those side effects include. So a lot of us were left just to figure this out on our own. And so the first thing when we enter into this situation is to seek validation and clarification of, if something's not right with my pet, could this be from the Librela? So an initial internet search is going to yield minimal, if anything at all. It'll say pain and swelling at the injection site. Well, that doesn't match, but when in fact the array and severity of the side effects is huge. So we're going to address the most common initial signs that are shared by pet parents. The first one I think that is the biggest indicator, but also the one most overlooked when it starts happening, confused mental state. The pet it's like they're vacant. They're just not all there mentally. They have a loss of personality, loss of mental alertness. Dementia-like behaviors is another description of this, and they're just kind of a shell of themselves. This one is often mistakenly attributed to a sudden onset of old age, mostly because we just didn't know. The pet parents didn't know these were outcomes of this drug. So do you want to speak to that first one specifically?
The first one, this drug is it's actually, I don't even like to call it a drug. It's a biologic. It is a monoclonal antibody, which is a whole new subset of biological products that they're genetically engineering. And there is a long stream of them coming down the pike. The very first one used in veterinary medicine was Cytopoint, which we have seen immune reactions from that. So it's a complicated, it's more than just a drug entering the body and attaching to a receptor, and then the drug going away from the body and releasing the receptor and everything goes back to normal. It's much more complicated than that. So this monoclonal antibody was genetically engineered using recombinant DNA techniques in chicken hamster cells, ovary cells, to bind to something in the body called nerve growth factor. Now, nerve growth factor is something our bodies make, our dogs' bodies make, our cats' bodies make, and it's relatively newly discovered in the 1950s. So we don't even have the science behind nerve growth factor to fully understand what that does in the body. We do know that it is involved with the repair and maintenance and growth and neuroplasticity of the entire nervous system. So that includes your peripheral nerves, your sinus, your spinal cord, and your brain. So when Librela goes in there and it binds to the natural nerve growth factor and makes it biologically inactive. And nerve growth factor is throughout the body, all the way throughout the body. So that's why we're getting these global effects. And one of the first effects is this confused mental state where we believe, I've been in messages with a board certified neurologist who's done research on brain dependent nerve growth factor. And when he heard about this particular sign, he's like, oh, this is crossing the blood-brain barrier. It has the potential to cross the blood-brain barrier, and this is one of the things that's showing us it is crossing the blood-brain barrier, which means it's getting into the brain and affecting the brain. Because yes, confused mental states and dementia we can see in older animals, but it's usually a very slowly progressive condition. It's not something that comes on out of nowhere. And, if we link it to them getting an injection and then all of a sudden your dog is like, whoa, what's going on? That's more evidence that it could be potentially coming from the Librela itself.
Okay. This next one, loss of coordination, stumbling, sudden limp may appear, knuckling when they walk, and hind end paralysis.
So this is where the nerve growth factor binding up the nerve growth factors affecting the peripheral nerves and the motor nerves, possibly even the cerebellum, which controls the limbs. So all of these, the loss of coordination, we call that in neurology ataxia. loss of coordination and stumbling. It's like the dog or cat starts walking like they're a drunk sailor. They don't know where their limbs are in space. And knuckling over is a loss of what they call conscious proprioception in neurology. Again, they can't feel that they're stepping on their wrong side of their foot. So they will put full weight down on the top of that foot. Okay, these are things that we look for in a regular neurological exam. Now, the ataxia and the loss of conscious proprioception can indicate a neurological lesion or problem anywhere from the sensory neuron all the way up the spinal cord to the brain. So it could be a problem anywhere along that nervous system, but it does indicate nervous system issue. And then the hind end paralysis is, again, speaking to this neurologist friend of mine, we're thinking it's probably dogs who initially had some type of a neurological deficit, but were not symptomatic. And then when the Librela hits their system and binds to that nerve growth factor, all of a sudden that's not available to help maintain their nervous system. And bam, you have this sudden hind limb paralysis. Now, there's only a few things that will cause sudden hind limb and paralysis in a dog. And that's, something putting pressure on the spinal cord and either severing it or a disc herniating out and putting enough pressure on the spinal cord that the signals stop getting through. So a hit by car, or again, a disc herniation, an acute disc herniation can cause that. We see that a lot in dachshunds. But that hind end paralysis is not something that just comes out of the blue. Um, and I've seen a couple of those cases, and it's like, wow, that it's a pretty severe reaction to have. And it's not just going to happen because your dog has old age. The problem being, the another issue with this is it's very difficult, and every veterinarian knows this, if you interview an orthopedic surgeon or a neurologist and general practitioners, sometimes it is very difficult in old dogs to separate clinical signs on what is a neurological problem versus what is an orthopedic problem. Arthritis would be an orthopedic problem. Um, so it's hard to separate that out. And often older dogs will have a little bit of both, you know? So on a physical exam, you can't separate that out. And so there's always that risk. Is there an underlying neurological, neurodegenerative condition that's in that dog that we just aren't seeing? So,
Moving on. Thank you for that. The next one that's one of the most common, extreme thirst, also excessive urination or total incontinence.
okay, these are interesting because the extreme thirst, which we call polydipsia, like increased drinking of water, and the excessive urination, which is increased urination, we call polyuria. Both of that, those symptoms can come from a couple different differential diagnoses. So one of them can be from kidney failure, something going on with the kidney. The other can be from some type of endocrine issue, either Cushing's disease or diabetes. And those are what we think of first off. Now, what's interesting is that one of the areas of the body where nerve growth factor is highly expressed in very concentrated amounts is the pituitary gland. The pituitary gland is a master gland for the body, for the whole entire endocrine system. And dogs, we're seeing a large uptick in the past decade in Cushing's disease in dogs, and that is because of usually pituitary tumors. But there's a question there, is this increased extreme thirst and excessive urination coming from the pituitary issues? and something going on with the nerve growth factor there. The total incontinence, urinary incontinence, could be actually a neurological problem because there's nerves that come off the sacrum that control the bladder sphincter. That can also be an endocrine issue as well. It can also be an issue from renal kidney failure because the dog just can't, is producing so much urine and can't hold the fluid in the body anymore from the kidney failure.
Okay. Next on this one is a whopper because of the damage it leads up to, and that is the loss of appetite. Something I found really, odd about this. First of all, I never knew anorexia could strike our pets. They'll usually eat anything you put in front of them, right? They're very enthusiastic eaters. But this particularly anorexia in pets is my understanding based on my investigations into this. The cognitive part of it is the appetite, but they still have the physical urge or desire to eat. So they have the hunger pain, but they don't have the cognitive interest in eating. That's the loss of appetite, is my understanding, is the cognitive piece of it.
So loss of appetite, I mean, we do see that a lot in dogs and cats. Cats especially, like if they get sick from anything, they'll just stop eating.
Okay.
Dogs will stop eating if there's any type of a GI issue or nausea or vomiting. Sometimes with chronic kidney failure, they'll stop eating because they have so much nausea involved with that, or liver issues. With this loss of appetite, what you're seeing, and I know it was a huge issue with your own dog, and it's almost like they want to eat, but they don't know, like there's something missing of them being able to eat or even open their jaw to chew to eat. The appetite is controlled by a part of the brain in the hypothalamus. So I'm just wondering, there's a potential that the appetite control system in the brain, in the central nervous system, is being affected. And that might be
Exactly.
part of this.
Exactly.
So, and it's hard to say. And also there can be, there's a big joint in the body with the TMJ, the temporal mandibular joint, that's needed in order to chew food. And if there's something going on with that joint as well, that could be a problem where they can't chew. Or if there's any type of issue with there's a whole subset of facial nerves that come off the brain, like usually around the ear, and control the jaw, control the movement of the tongue, and all of that combined together, that could be part of it as well. So
Yeah,
this gets really complex really fast when you're talking neurologically, you know.
it does. And while we're on this particular item, number 5, I want to give some validation to the pet parents who are recognizing their pet having trouble locating their food in their bowl, or locating the water in their water dish,
Wow.
or picking up the food. It's all related to what you just said about the facial nerves and the functionality of the mouth, the tongue, the jaw. Everything seems to just go away. They
Wow.
struggle with the physical ability to eat. And I just want pet parents watching this to understand those are indicators of this as well. Big ones,
And
actually.
the sense of smell could be involved in there too.
Yes. Yes, that
Where
was
because
also.
dogs, they're a huge part of the dog's brain is their olfactory lobe of the brain, is kind of like our visual lobe. So if the olfactory lobe of the brain is being affected, which, from the loss of nerve growth factor, then they won't have their sense of smell. And that could also be even how they use that to guide themselves around their environment as well. So
That was actually, yeah, go ahead.
it would be like us going blind, you
Oh,
know.
it was, and that was part of my experience with this.
Mm.
And he, no, when we take our dogs for walks, they
Hmm.
They sniff. My dog would sniff every blade of grass. Walks took 10 times longer than they needed to when he was
Yeah.
in health because he smelled everything. So yeah, that loss of sense of smell, if you notice that, um, it's a big one. That is a big indicator, pet parents, a huge indicator that something is happening. So I'll move to the next one, which I just clicked up, which is anxiety. These dogs and cats who've had this reaction start showing signs of extreme anxiety. Things like they don't want to leave your side, they're paranoid, pacing at night, lots of different indicators of anxiety associated with this reaction.
Well, this, I mean, anxiety, if you're a human and you go suddenly blind, you're going to be anxious. And if a dog suddenly loses its sense of smell, or even like the ataxia and the uncoordination, an animal, for them to survive, they need to have their wits about them and be able to move and be able to run from predators and to be able to take care of themselves. And when they start losing those functions, it's super, super scary for them. I mean, it would be like us where all of a sudden you're a paraplegic or something, or you can't see, the anxiety levels are gonna go through the roof on that. So I think it's a whole combination of them possibly losing some of their sensory and just not knowing what's going on. And, it's so sad because unfortunately we can't talk to our animals. We can't even explain this stuff to them, and it's just happening to them.
Exactly.
So, yeah.
Okay, next item. Heavy breathing, panting, and a strange cough. That one has been distinctive to this experience
Mm,
as well. And it's not a constant cough. It's an occasional cough, like something stuck in the throat. And you're like, oh, that's
mm,
odd. But it keeps happening, a few times a day, maybe once a day for a week or so. And you're like, that's new, honey. Do you need some water? It's
that's
confusing about why it's
interesting.
happening, but it is distinctive to these reactions. And again, relating to my personal experience,
Hmm.
he ended up with esophagitis and
Mm.
what was the other one? Oh, the
Laryngeal.
yes, the inflammation of the larynx.
Wow. So actually inflammation in there. I was gonna say there's the larynx is the part of the throat that actually covers the airway when we swallow. And it's controlled by nerves. Again, there's a nervous control of that. So there is a syndrome in dogs where they get laryngeal paralysis. And there's two flaps, one on either side, and oftentimes it'll be one-sided. So when they go to swallow, only half the airway will be closed and the other half will be open, and they will tend to inhale liquid down the airway, and then like they'll do this strange, like you said, the strange cough. I said strange cough without looking at it, but I'm actually treating a Librela dog who had that, and I was thinking, well, maybe the dog has laryngeal paralysis underlying, and but yeah, it could just be from the nerves, the innervation of the larynx, and then that's not working, and they're actually, it would be like swallowing something the wrong way.
Yeah,
And if
that's what
and
it
if
sounds like.
yeah, and if you're swallowing stuff and getting stuff down in that trachea, that's going to cause inflammation in there too, you know.
And that one is
Mm.
related to this next one, which
The
also
barking.
afflicted my dog, who was an avid barker. He was a mini schnauzer. They like to bark. And he all of a
Oh.
sudden, the first time, and this is common amongst other pet parent reports of what's happening, or curiosities about, is this related to the injection? And the answer is yes, it very much is. If they just suddenly stop barking, or more distinctly, they bark and it sounds kind of hoarse, like it hurt them, then they stop barking. That is distinctive to this experience, and that did happen with my little boy.
Wow. So again, I mean, that could be an inner having to do with the nerves there. They do there's a procedure, a debarking procedure they use on dogs, and I believe they go in and cut the vocal cords when they do that, or they could cut, but I would think it could definitely be related again to the nerves, just the nerves
Exactly.
not functioning. And we when I said at the beginning of this, we know so little about nerve growth factor and what it does in the body. And this whole issue with this product and these injections, it's like a giant science experiment. We're learning, well, all these things that nerve growth factor helps with, because once it's removed, boom, like, stopping barking. And that can be a really big deal.
Exactly. Next one
Wow.
that's really very common and also one of the very first signs of this reaction is skin conditions. A lot of pet parents reporting skin conditions, some of them mild itching, but still new to their pet. Others are extensive with lesions and nonstop.
Mm.
I've seen some videos of them. They're really uh, drastic.
Severe. Well, there's with the nerve growth factor, one of the things that they have done some research on is how it helps the sensory nerves in the periphery. And the skin is filled with a lot of sensory nerves, so it's doing something there. And my other thought is also, when I looked up, there's a lot of research and a lot of meta-analysis with monoclonal antibody stuff in humans, because they've been using it for cancer therapies and other therapies. And there are pictures of people that have broken out with immune mediated conditions from the monoclonal. Because what happens is a monoclonal antibody, it's a giant foreign protein, and we're injecting it into the body, and the body's response to giant proteins circulating around in the bloodstream is to mount an immune response to it. And so some of these, like the more severe skin conditions, it's almost like an autoimmune condition, pemphigus foliaceus or something, where the immune system just attacks that part of the body, because there's all this foreign protein called Librela that's been deposited there. So it sends in monocytes and cytokines, and just this huge inflammatory reaction ensues. So, and
That's
that is,
exactly, yeah, that fits the description. It's
yeah.
an inflammatory
And
reaction. Yeah.
yeah, and then, if there's any autoantibodies, if there's any antibodies that the body makes to the Librela, it will just turn into a big autoimmune type issue. Um, and that is one of the very few side effects that is mentioned in the initial US package insert. So,
Okay. Yes, exactly. And we have that in one of our slides as well. And then
yeah.
our last one on this particular list is the eye conditions. That's been commonly reported and an
Wow.
indicator that pet parents need to look out for. Things ranging from an itchy eye, an inflamed eye, or severe lesions on the eye, and sudden blindness. Sudden blindness has been reported by pet parents significantly.
Wow. So one of the really highly innervated tissues of the body is the cornea. That's why when you scratch your cornea, if you've ever scratched your eye, it hurts so bad. But that's a defense mechanism built into the body, that, oh, something hit the eye, to make it blink or to pull away. And so with that many nerves in there, then again, we're looking at something not allowing the nerves to function the way they need to function. And then with the sudden blindness, that's just really, I mean, it just hits me. It's really scary. And so it could actually be attacking shutting down the optic nerve, or central nervous system issues.
We would be remiss if we didn't also address the most severe reactions, those including death within hours of receiving the injections. And in rapid progression, I've seen a number of pet parent stories where this happens either within hours or a few days. partial or full paralysis, incontinence, seizures, and death. These are the most severe stories that I've read, and they are in the hundreds, without question. Just that I've personally been familiar with.
So the death within hours of receiving the injection, that to me just speaks of some type of an immune reaction, of a severe either anaphylactic reaction, which is listed on the product package insert in some countries. It wasn't listed in the United States. But if there's an anaphylactic reaction, that's like a type 1 auto immune mediated reaction. The best analogy is like somebody who's allergic to shellfish, and you just have this your body just amounts this overwhelming immune reaction that overwhelms the body, and literally, things can swell up, things can start bleeding, and death can ensue. So I would, probably those cases are probably experiencing that, and with all of these reactions, the thing that people have to understand is they're not predictable. There is no way for a doctor, a veterinarian, or anyone to be able to predict, if you put 10 dogs or cats in front of you and you injected them, what this injection is going to do in their body. Because it's just too complex. We're dealing with very complex mechanisms here. And then the rapid progression, hours to day, is also probably some type of an immune mediated reaction. I was just reading in the human literature about monoclonal antibodies, and they were talking about how they see them just on the monoclonal antibody portion of this. It doesn't have to have anything to do with new growth factor, but they will produce all 4 different types of immune mediated reactions, from anaphylaxis all the way to type 4, and they're giving them all kinds of strange names. But that sounds to me what's happening in these cases. And it's like once the train has left the station in a lot of these, there's no returning it. I mean, these would be cases in the ER where you're pumping the animal full of epinephrine and drugs to try to stop that immune system response. And once it reaches a certain point, there's just no stopping it, unfortunately.
This graphic has been shared extensively amongst the pet parents communities on this topic. It is important to share this here because, again, reinforcing that many pet parents have been told there are no side effects, which is not correct. This is a list of side effects compiled from the package inserts published by the drug manufacturer, Zoetis, from the package inserts from the EU, the United States, and from Canada. So in that list are many of the things that you and I have already discussed.
And, I think what's important for people to understand about this piece of information is this is not, this is mostly coming from the Canadian package insert. And then the Canadian happens to have the most information on it. And then next is the EU package insert. The United States package insert had very little of this on it. So if you take this into your veterinarian, they're going to be like, well, we didn't see any of this listed. And in this day and age, because there is so much false information out there, or anything, it's going to be tough, it's going to be tough. So I just want people to be aware of that. But these are listed between the EU, the USA, and the Canadian. These are things listed.
Yes. So if for any pet parents who are told this does not have side effects, one of the first documents that we will recommend that you refer to or refer your vet to is that Canadian insert, as you described. Moving on, not to belabor the topic of all the side effects, the extensiveness of them, a huge database collecting the reported side effects is the UDRA Vigilance Veterinary Database of Suspected Adverse Drug Reaction Reports, commonly known as EVVET. And to drive home the point of how extensive the list of side effects is they actually have them categorized into more than 18 categories. And we don't have to go through each one of these, but I think visually seeing this list
Mhm.
uh, is is remarkable, and pet parents need to understand, yes, this is happening. You're not crazy. You are seeing what you're seeing.
Yes.
It is reported, and that database has over 20,000 adverse reaction reports to date. And that's
Yeah,
just
it's and that can be all be found on the website here. It's a really amazing database with graphs on there. I know that, yeah, like as of August 13th, it was like 18,648 cases reported. 88% of those were reported by vets. And another really important point about that is that that is probably only 1 to 5% of the total cases reported.
exactly, because reporting, they are underreported without
Yes.
question. There's
Yes.
another unknown number as far as quantifying all of this, which is important. The huge unknown number is the number of pet parents who endured this and lost their pet to it and have no idea, never made the connection
Mhm.
between receiving this injection and the subsequent euthanization of their pet. There's that group out there is an anomaly because they still don't even know.
No, they don't know. And veterinarians are not connecting the dots on this. Reporting is extremely important so that we have the data. We need the data. And even if you don't think it's every little report is important.
You've already talked about this in our conversation thus far, but we have on the Pet Advocate website, there's a graphic describing what
Mhm.
you were explaining about nerve growth factor.
Yeah, and there's two parts to this. So there's the nerve growth factor, which has to do with our entire nervous system, which reaches every single part of our body, every single organ. The nervous system's tied into the endocrine system and into the immune system. They're all coordinated. Then and so I love this graphic that you did because it just shows it. But then on top of that is the actual monoclonal antibody issue. And I have a quote here that is from the FDA itself, quoting all therapeutic proteins, which is what a monoclonal antibody is, all therapeutic proteins, including monoclonal antibodies, can trigger an immune response, which they call immunogenicity in an animal. Antibodies binding to Librela, called anti-drug antibodies or ADAs. Now, these are antibodies created by the animal's body because they see that injected Librela as a foreign invader. These antibodies, anti-drug antibodies, were detected in a small number of dogs in the 6-month laboratory safety study and the 2 field studies. Some dogs in both the treatment and control groups were confirmed to have anti-drug antibodies present prior to treatment administration or confirmed to develop ADAs following treatment with Librela. However, due to assay limitations, the clinical effects of this immunogenicity could not be determined. So the FDA already acknowledges finding these anti-drug antibodies. Now, an anti-drug antibody against Librela is going to bind and it's going to set the whole immune-mediated reaction into play. And then that's where we get monoclonal antibodies. And this is a quote from the human literature. Monoclonal antibodies may cause types 1 anaphylaxis and urticaria. Urticaria are severe itching rashes. Type 2 hemolytic anemia, immune-mediated thrombocytopenia, possibly early onset neutropenia, which are low white blood cells. Type 3 serum sickness and pneumonitis. Type 4 toxic epidermal necrolysis, which is where the skin is just peeling off and
Oh,
major skin lesions, and what they call Stevens-Johnson syndrome in human medicine. They can cause all these hypersensitivities, quote, as well as other cutaneous, pulmonary, cardiac, and liver adverse events. A common feature of most of these syndromes is the release of a cascade of cytokines associated with inflammatory and immunological processes. So this is straight out of the human literature. So there's no doubt that they know, science knows what these things can do in the body.
yeah.
This
So
is
that
not my words. This is the FDA's words and a clinical published study's words.
that's profound. Thank you for sharing that quote.
Yeah.
And for our pet parents trying to understand this, it's it's not just one thing that's happening to your pet that you can treat in
No,
response to this reaction. It's system wide. It's
it's a
every
systemic,
system and organ.
yeah. Um,
So therefore, treating it, I think that segues us into the next part of this
mm,
conversation, which is, okay, well, let's actually address this too, because a big question, a lot of the pet parents are we're just trying to make sense out of what's going on. And another one of the big questions is, I noted this as 1B because it wasn't in the
yeah, that's
original
fine.
list. Are there certain pets who are more at risk for this than others? And I'm going to let Dr. Duncan Lascelles answer this with a quote from him. Who is Dr. Duncan Lascelles? Is a professor of translational pain research and management at North Carolina State University's College of Veterinary Medicine, who helped Zoetis design the Solensia studies.
Mhm.
And the quote is, I don't know what cases they're not right for. That's something we learn over time. And that was published in the Wall Street Journal article that is dated April 12th of 2024. I think that speaks volumes.
Yeah. I mean, we're all of these animals right now are the stage 3 clinical trials is what that state says. And it goes back to what I was saying before about there is no way we can predict how an individual animal is going to respond to this. Even a young, healthy animal, if they have some type of an immunodeficiency or too much inflammation in their body or some neurological condition, anything could happen. We don't know.
Exactly. Exactly. That's the point I really wanted to drive home for our pet parents because they're trying to, as we do, trying to narrow down. Well,
Yeah, yeah.
which groups are not right for the, who seems to be more predisposed than others? And the answer is there isn't a
It
distinction of
depends.
this.
Yeah, yeah, it
So
depends.
people have asked, is it, oh, maybe you shouldn't give it to older dogs. Is it breed specific? Because I've had conversations with people who note that collies in particular are very prone to certain diseases. So is it breed specific? What about pets who have chronic health conditions? And then this last one I really want to kind of expand upon, neurological conditions. Well, okay, if that is a precursor or pre-exposes them to something terrible, how would neurological conditions be properly identified prior to the administration of this injection? And it's my understanding the answer to that is a very expensive MRI or a CT scan.
And I will just add that not every MRI or CT scan is going to pick up every single neurological condition. You can have a peripheral neurological condition. You can have a degenerative neurological condition like degenerative myelopathy that shows up in dogs. If it's at the beginning of that stages of those conditions, you're not going to see that in an MRI or CT. But you take away nerve growth factor all of a sudden, and then bam, you could be right in the middle of that condition. Is what it
Absolutely.
like is happening. Um,
And
again,
I,
it's like
go
a
ahead.
big experiment to figure out what nerve growth factor does in the body. I,
Yes. I will take a moment to expand upon the age issue because
Mhm.
I read a quote from another doctor in another article that is on the Pet Advocate website. And he made the very prosaic statement of older dogs need all the nerve growth factor they can get because it's reduced in their body just from age anyway. So you
Yep.
inhibit that further, then absolutely older dogs are going to have a
Yep.
greater risk for an adverse reaction. I think that one really is one of those
Well, and
kind of obvious ones.
because I do acupuncture and I do alternative modalities, I've become over the past like 20 years somewhat of an expert in geriatric medicine because that's mainly what I've been treating. And these older animals come in and the body wants to maintain balance. It wants to maintain homeostasis. It will try everything possible to keep everything functioning. And so a lot of these older animals are in this very delicate balance. So and you can add things to them to help support them, but if you take like a bullet and a really strong therapy, even I've seen this happen with just drugs that don't might not affect a younger animal, but you give it to an older animal and it is enough to just topple that balance. It's like pulling the, I don't know what that that game is where you pull out the wrong stick and then the whole tower comes crashing down.
Jenga, yeah.
Yeah, and that's exactly what is I think is happening with a lot of these older animals.
The pet parent suspicions have been confirmed. So the next set of questions typically include, and this is the panic mode. Okay, is there an antidote? Can I detox from that? How do I get this drug out of my pet system? You took the
Um,
time to draft what we called a recovery protocol. But I'm going to let you talk about that first one. Can you detox? Is there an antidote? I'm going to let you address that.
I mean, we're talking about, again, this is such a brand new modality. It's such a brand new treatment that it's hard to say. It's not like we can wait for the monoclonal antibodies, like the half-life, and for it to disappear because of the fact that it's going into the body and it's triggering these like the whole cytokine thing and the immune mediated reactions. Once that button is pushed, it goes far beyond the Librela being present or not. Um, One of the things that I'm putting together my recovery protocol, because I had early on, I had several patients, they had moved out of town, their animals were doing great, they were recommended the shot, and they called me up going, my dog's paralyzed right now, what do I do? Like literally, and I just, my heart goes out to them. So reverse engineering it, one of the things is to try to support the body with extremely good nutrition. And some of these dogs aren't eating a lot. So what you get into them has to be clean, has to be without heavy metals, without pesticides, without other stuff their body needs to deal with. And as potent, like concentrated nutrition as you can get. It has to be anti-inflammatory to reduce any inflammation that may be going on in the body and to support the organs so that they can hopefully keep functioning through all this. And then um, helping the body make more nerve growth factor. There is an amazing medicinal mushroom, and I have a whole class I've taught on medicinal mushrooms if anyone's interested. But there's an amazing medicinal mushroom called lion's mane, which actually can increase the production of nerve growth factor, but it takes a month or two to kick in. All of these natural formulas, it's not like giving a magic bullet drug. It takes a while because we're working with the body's healing process. The other thing is because this Librela is a protein and it's creating antibody antigen complexes, which are large proteins. Trying to remove those proteins from the bloodstream is another thing. And I've used proteolytic enzyme therapy. It was something that was actually introduced way back in the 1930s. And people were using it for cancer therapy back then and have been using it for cancer therapy now. I was using it about 15 years ago, and then I kind of stopped using it. And then this happened, and I'm like, wow, protease. It has to be a very concentrated version of the enzyme that will dissolve protein molecules that can
Okay.
actually help clean out the bloodstream and is actually immune and will help modulate the immune system to help modulate that immune mediated response that we're seeing. So it may, hopefully it may help. I've actually had some cases that have come through pretty good using this protocol, but it depends, it depends upon so many factors. And it's not good. The one thing I can tell you is everything that I listed in my protocol, it is not going to hurt your animal.
Okay.
It's not going to cause damage.
Good.
So,
Good.
yeah, yeah.
So, another one of these common questions, well, how long does it stay in their system? And it's my understanding there's no definitive answer to that.
There really isn't. There is a half-life calculator that was put together. Um, to determine the half-life of Librela. But again, because the Librela is number one, triggering these immune mediated reactions and then blinding the nerve growth factor. The question more is how much damage is being done to the immune system and what time does it take for the body to produce more nerve growth factor to get
Yeah.
that back online? I mean, I think
Okay.
that's the really important part of it.
And something, a lot of the pet parents have been advised by their vets that Librela is a way to go, and it's a safer option for osteoarthritis patients because it does not process through the liver and kidney. And so I wanted you to address that because I know a lot of pet parents are being told this as why it's a way to go and why it is a product that is promoted.
It's part of the marketing campaign. They started really making non-steroidal anti-inflammatory drugs really kind of like the evil bad guys, when in reality, I've been using them for 25 years on my arthritis cases. My own dog is on a non-steroidal anti-inflammatory on an as-needed basis for arthritis. Yeah, those are processed through liver and kidneys. There are occasional severe reactions to those, but nowhere near what we are seeing with the reactions with Librela. And oftentimes when you catch them early, you can go in and repair that damage that's done. So I would not consider this a safer alternative. If a veterinarian says this, then they need to go back to their immunology books, and they need an easy thing to think about is if a foreign protein enters the body either through leaky gut syndrome and gets into the bloodstream, with that, the foreign protein produces a food allergy
Hmm.
and the body will react. That's where we get like chicken food allergies and beef food allergies. Most food allergies are to proteins. Like the body is hardwired to react to foreign proteins. And that's what the monoclonal antibody is. And they're not broken down by the liver and kidney detoxification pathways. They have to be processed intracellularly or through enzymes, through protease that starts breaking it down. They have not even figured out fully how Librela is processed in the body. They haven't followed, there's big assumptions being made that, oh yeah, we think it's broken down the same way as blah, blah, blah. But they don't know. They don't know
No,
that for sure. So,
exactly.
how can they say it's safer when they don't even know the exact mechanism of how it's broken down?
Exactly.
Uh,
Important understanding for our pet parents
yeah.
trying to address this. Now that they understand all of this about the nerve growth factor and what's happening in the pet's body, is it even safe to give other medications or pain relievers with this drug? I personally was terrified to introduce other pharmaceuticals into my dog's body that was already so extremely compromised, especially cognitively. as well as all the other physical. And so
Yeah.
I stayed away from them completely because no one could tell me.
Yeah, and they can't, they say in the package insert they don't know whether it's safe to give to dogs with NSAIDs. I think they did a safety trial that lasted like, I don't know, like a month. It was a ridiculously, I don't even know why they wasted their time doing it when I looked at the number of dogs involved and the short amount of time involved. Um, what you really need to look out for this is like for NSAIDs, you need to look at their liver and kidney function. But one of the things that we're seeing is kidney function decreased because when the Librela binds to the nerve growth factor, you get an immune complex, which is Librela is a big protein combined with nerve growth factor. It's a giant protein. Those
Ah,
immune complexes lodge in the tiny little vessels in the kidney called the glomeruli in the kidney's filtration system. So they block up the filter in the kidney and create inflammation and actually lead to glomerular nephritis, which is a form of kidney failure. So throwing an NSAID in on top, if they do have any of that kidney failure, then that's not going to be a good thing. Using, opioids, that's going to affect them mentally. If if the animal is really suffering an extreme amount of suffering, you might think of doing something like that. Gabapentin is another drug that people can look up on the internet. I wrote an article years and years ago about gabapentin through Dogs Naturally magazine and traced the money trail from Pfizer through gabapentin and how it got dumped from human medicine into veterinary medicine. There is still to this day not a single controlled, double-blind controlled study using any kind of force plate analysis or anything like that proving gabapentin does anything for pain. It is
wow.
now a controlled substance in 5 states, and it's called Budweiser on the street because it makes people feel like they drank a 6-pack of beer.
Wow.
Yeah.
Okay.
So gabapentin can go in the same dustbin as Librela, in my opinion. And I would not use it on these guys if there's any kind of cognitive issues. I've seen it cause ataxia and incoordination. I've seen it cause breathing problems if combined with an opiate. So there's a lot of issues with that medication as well. Again, you might be better off going to some kind of an opioid if they're in severe pain and suffering, and that's a whole nother discussion too.
The other
Yeah.
part of the inflammation and to maybe help with if the inflammation is causing some of the pain, address that. What about steroids? Is it safe to introduce those into the system?
Well, steroids are the go-to if they are having some immune-mediated reaction, like autoimmune hemolytic anemia or immune-mediated thrombocytopenia, where the body's immune system triggers and is destroying platelets. We will reach for high doses of steroids, so like prednisone. Prednisone was the go-to, and a lot of neurologists, good old-time neurologists, will still say if there's a bulging disc or if you have a blockage pressure on the spinal cord, get the steroids on board because it's going to take that pressure off the spinal cord and it's going to help. Now, with these guys with the nerve growth factor issue, I don't know that steroids will hurt so much, but just if they're having one of those immune mediated reactions or massive skin problems, it may very well be worth reaching for steroids. But I would do it under the direction of a veterinarian because you can use high doses safely, but they need to be on stomach protectants and things like that, and they need to be monitored closely.
A lot of pet parents have asked about CBD. I was also curious, like, again, is it safe to introduce this into their system?
CBD is one of the safest compounds out there. They gave for a lot of chemical compounds and different drugs, they have to do what's called an LD50 test, where they'll take a population of animals and give them increasing higher levels of the medication or drug until 50% of the population dies. And then they get what's called the lethal dose 50. They could not come up with a lethal dose of CBD. And a lot of people don't realize this. If they get too much CBD, the worst thing that's going to happen is they're going to fall asleep and sleep all day. I've treated animals for marijuana toxicity, which actually has the THC with the CBD, and you just watch them and make sure that they don't vomit or regurgitate while they're sleeping, and we swallow it essentially, and they will eventually sleep it off. CBD may be actually really useful in these cases because what they found is that it acts to help maintain homeostasis in the body, and it helps the immune system communicate with the nervous system, communicate with the endocrine system. And it's very calming and soothing, especially with these dogs exhibiting anxiety. And it may just help calm them down a little bit. There was an amazing study done out of Cornell University using CBD for arthritis in knee problems, because there are cannabinoid receptors in every single joint. So they found that that was a force plate analysis study done showing CBD helped with pain in arthritic knees. So it could help the arthritis. The other thing it does is it can help the appetite, and it may help balance things out. So if it were my dog, I would be loading them up on CBD, if nothing else, to help them get a good night's sleep so they don't have to pace around,
That's
and be so
extremely
anxious.
helpful.
Yeah.
Extremely helpful to know.
Yeah.
Let's see what's next here. Okay. What if vaccines or other monoclonal antibodies like Cytopoint are given at the same time or within weeks of Librela?
We have no idea, but all of that, that could just amp up the threshold point in my mind for an immune mediated reaction, because now you're talking about loading up the body with even more monoclonal antibodies, even more foreign proteins for that immune system to develop antibodies to. So I would not, and vaccines should be included in that as well. I would not put a vaccine in a dog having any of these reactions. So,
Okay. And that leads us to also, what about anesthesia? It's common knowledge that you don't put older dogs under. It's just too stressful for their system. What if it's not an older dog, but they have Librela in their system and maybe already starting to show some signs of a reaction, but the pet parents don't even know yet. They haven't made the connection.
it depends upon what kind of anesthesia. There's gas anesthetics that very little, small percentage of the gas anesthetics will go through the liver or kidney, and they're mostly blown back all through the lungs. So, and it depends upon who's doing the anesthesia. So I would stay away from injectable anesthetics. The injectable anesthetics are pre-anesthetics, like the opioids, like ketamine, tilazol, things like that, because some of those actually have effects on the central nervous system, even hallucinatory and other types of effects. But a gas anesthesia should be okay, like if you have to do an MRI or CT scan or something like
Oh,
that. And
okay,
if they're doing anesthesia, I would treat it like a older dog with cardiac problems and just do a very, very safe, light anesthesia protocol that could be reversed easily, if there's problems. Yeah.
good. Okay, so next, moving on. All right, you've already addressed a part of this. Is what else can I do to support my pet at home? Nutrition being the one you already mentioned is just mission critical. But
Yes.
I want to drive home the point here because this was part of the major learning curve of this whole experience, and that is it's absolutely not common knowledge that most of the pet foods on the market are not only not nutritious, they can be genuinely harmful.
Yes.
So yeah, I wasn't aware of that, and my
Mhm.
whole life I've had pets, and I when we go to the vet, we're initially asked, "What are you feeding?" And you tell them, and
Mhm.
I've never been corrected. I've never been told, "Oh, that food is really not good. Please do this instead." That conversation's never occurred for me.
No, because big pet food is, my first day of veterinary school, I was met with people handing me free bags of Hill Science Diet. I was probably the only one there that didn't accept the free bags of Hill Science Diet because I was already making my own cat food. But the pet food industry is so big, it's multi-billions of dollars. Purina made $22 billion a year last year. $22 billion, and that's only one company. What they have done is essentially taking all the waste products from the human food and dumped it into pet food. So most of the kibble is protein is the 4D animals, the dead, diseased, dying, and degenerate
Oh,
animals, and they've figured out a way to put that into a kibble, mix it in with other ingredients. You've got the corn lobbies, so a lot of these, I recommend everybody read your pet food bag, and if it's a whole bunch of stuff that you can't even pronounce, and if there are wheat gluten, corn gluten, high fructose corn syrup, all of these types of things in there, that dogs and cats should not be eating corn products. They should not be eating wheat products, period. It just, there's at the same time that this crisis was going on, there's been a huge pet food crisis going on as well, which has remained unanswered by the FDA as of this time. And so you really need to, there are so many options available online, but if you can't make your own pet food, there are so many commercial available options, which is what my pet food list is commercial pet foods. And you think they might be more expensive. I also want to add in here, Dr. Susan Thixton has the truth about pet food. Her website is invaluable, and she puts out a list every year on the pet foods. She collects information from them, and only certain pet foods make it to her list. It's $11. It supports her work. She's totally doing it this out of the goodness of her heart. She's going to AFCO meetings, but there's a big push right now to do away with state regulation of pet foods, and the FDA wants to take over the whole entire thing. And we're afraid that they're going to start wanting to shut down small pet food manufacturers like the people that are on my list. So, but yeah, a lot of the food on my list, you can feed for, it's not as expensive as a crappy food. Your dogs are not going to have dental problems. They're not going to have ear infections. They're not going to have skin problems. You are going to save so much money on vet bills, and it's going to help prevent arthritis and prevent chronic disease and Cushing and diabetes. And, these are all metabolic diseases, all caused by food. So,
excellent. I do want to highlight what you already mentioned, that your list of favorite pet foods is available either from you directly or on the Pet
on the page.
Advocare website as well. So that's for purchase options. For those who currently do or are willing to cook for their pets at home, something else that's just not common knowledge are all the foods that are toxic to pets. Most right high on the list. I think everyone knows about chocolate for dogs, for
Yeah.
example, but onions are a
Yeah.
big one.
Onions are a huge one. Chocolate. You can go online and find lists. Some of them actually have some, like people say avocados are toxic. They aren't. I mean, yeah, if they swallow the whole pit, that's going to be a
Yeah.
problem. But we have dogs in Florida eating so many avocados. We wouldn't have a dog left in Florida if they were toxic to avocados. But you can go on and find out. And, I just tell people dogs do need some salt for minerals, but just don't season up the food a lot. And there's some excellent books out there. There's a new one out by Dr. Karen Becker and Ronnie Habib called the oh, what is it? It just came out. It's a beautiful picture book, and it's loaded with recipes that you can
Oh,
make at
great.
home. Dr. Judy Morgan is coming. She has a good book out called Yin and Yang of pet food. She's coming out with a brand new book of balanced recipes. And these are things that you can go to the grocery store, pick up off the shelf, and come home and fix for your animal. So there are lots of good resources out there.
So food, nutrition, get some solid nutrition into them. And there are supplements. Now this discussion could be huge and we don't need to
Yeah,
belabor
it's
it. It's already in your
exactly.
protocol
Yep.
that we mentioned earlier, but there are a number of pet parent recommended supplements that people have had success with in
Mhm.
certain areas, also available on that website. But
Mhm.
for me personally, and so if I experienced it, I'm sure others have or will also, and that is, again, you're in panic mode. You want to give your pet everything you can get your hands on that might help them. And in that process, you could very easily overload their system.
Yeah.
So I
Keep
just
it
want to
simple. Less is more. I mean, I talk to people all the time on consults and I'm like, just get rid of this, get rid of this, get rid of this. I don't, I try to stay away from the supplements that have 20 different things in them because think
ah,
about it. You're giving a half a teaspoon to a little dog and it's got 20 things in it. How much of each one of those things are they actually getting? So that's why and brands are important. There is nobody regulating the supplement industry. So you have to be sure what you're using actually even has the stuff in there. So that's why on and I mentioned that on my recommended list as well. There are only certain brands that I feel comfortable using, and that's what I recommend. Yeah.
specific products that pet parents have already experienced success with, as
Hmm.
well as obviously our professionals' recommendations. So again, that list is available from you directly, and there's also one put together by pet parents and the team at Epic Care. All right, so we're
What's the
also gonna,
kids?
yeah, the anorexia. So help help our pet parents whose pet won't eat. They're refusing their favorite foods. I mean, this one's really terrifying. It was for me. It was very frightening, and obviously, if you can't get nutrition into them, their body can't recover. That's what makes this one so terrifying
Yeah.
for the pet parent.
Yeah.
And I again, relaying my own experience, there was one time I had 7 dishes of different food out for him, and he was clearly hungry. You get the hungry eyes. They look at you with the hungry eyes. You put
Hmm.
everything in front of them that you think that they would love,
Hmm.
and they don't eat any of it. And then they look
Hmm.
at you again with the hungry eyes. It's a
Hmm.
terrifying experience. So that first bullet there, how do I get my pet to eat?
And I'm just wondering if some of it is, almost like with what they say with COVID, with the loss of smell. If there's a loss of smell, then there's loss of taste too. So I deal with this with a lot with geriatric animals, with cancer patients. So one of the things is to have that variety. I call it like the lazy Susan of your 7 or 8 bowls, and what they eat one day may not be what they eat the next, but you circle back around to it and they may eat it 3, 4 days later, a week or two later. So don't use small portions. Don't open up a whole can to let it go to waste. But what I would do is offer them a small little bite. If they want that, then go ahead and get more out to give them. The other thing is cats is very dangerous. They have got to eat. They cannot go more than 24 hours without eating, or they go into pancreatitis and fatty liver syndrome and they'll die. So I have actually, and this may work for small dogs as well, is make up like milkshakes. I call them like liver milkshakes. So I may take either a really good brand of food, one of them now that just came out, Green Juju, has a lot of organ meat in there because the organ meats have a lot of nutrients. You can put in bone broth, you can water it down with warm water, some goat's milk, and you can syringe feed that. And this may be a little bit off topic, but like raw milk, goat's milk, or raw A2 cow's milk grows small little goats and small little cows into big ones. So if they're not eating anything else, you can syringe feed milk into them. And the raw milk has all of the enzymes in there needed to digest it. and it will provide all of the amino acids and all of the nutrients that animal needs. And it might be able to pull them through just syringing that. And some, I would warm it up. The other thing is to coax them to eat. Take a little bit of food and just shove up underneath their lip into their mouth. And sometimes and some dogs who aren't eating at all, they will sit there and eat if their owner hand feeds them.
Yes.
So that is a big issue, is hand feeding as well. And I know it's super frustrating because we love them so much and we're just like, please eat. And,
Yeah,
and it's very, very frustrating.
it was. One thing I'll just add to that that was helpful is it seemed again referencing the loss of sense of smell.
Hmm.
If I went to the smellier the better foods, for example
Hmm.
salmon, because that smell is so strong, it can maybe get through and trigger the desire to eat. So
And
I had some success with fish.
warming it up a little bit, even if you put it in the microwave. I don't like microwaves, but even just for like 3 or 4 seconds, because it gets the aroma going from the warm food, and that can sometimes coax them, just initiating them into eating.
Yes,
So
and so salmon and also sardines.
yeah.
Uh,
And
that is
sardines
super
are
smelly.
and sardines and salmon, sardines are so good for them. They're loaded with omega-3s. They're going to take down that inflammation as well, and they're going to help support the kidneys and the skin and, everything.
Exactly.
So the sardines are a great option.
And
Um,
one of the things that a veterinary's response to the not eating is these appetite stimulant medications. Again, I was very hesitant to use them because my pet was already having the mental reaction to the loss of mental acuity and cognitive
yeah.
function. And
And
these being antidepressants, I was like, he's already having psychological effects. Do I
yeah.
want to add another drug that has psychological effects?
I wouldn't use the antidepressants in there or something that's going to affect the central nervous system in the brain. Like you said, the brain is already having a difficult time. There are sometimes if your vet will do it, for one thing, if they're not eating, they may be dehydrated. So doing some sub-Q fluids, I teach my clients how to do sub-Q fluids at home all the time. And some vets are really scared to do that, but it's super easy. And then you can add in B complex, vitamin B12, injectable can often help with the appetite. This is old, the old school of veterinary medicine, but the vitamin B12 and the vitamin B complex are not going to hurt them. And sometimes, for whatever reason, it can kickstart their appetite. So
Fantastic.
that's another issue.
And can acupuncture help? And I'm going to go ahead and say yes, it can. And I learned
Yes.
when I took my
Yeah.
boy in for acupuncture, there's an appetite stimulant point right on their nose. And well, I'll tell you what, the day we got home from that acupuncture session, he ate a
Mhm.
bowl of beef stew all on his own just from that. So the answer is yes.
Yeah, and the appetite stimulation point, it's right where the haired and non-skin haired meet, right on the very top of the nose on the midline. And you don't have to have a needle to stimulate that point. You can
Ah,
take your fingernail, you can take the pen, tip of a pen cap or something and just rub that point or press that point and do acupressure on it. And for a few minutes or however long they'll allow you to do that, and then offer them the food. So that point can be stimulated at home. And acupuncture in and of itself, I've been practicing it for 25 years. I teach acupuncture, and every day, every week, I'll put these funny, tiny, itty bitty little needles in, and I'm like, oh, am I really doing anything? And as soon as I doubt myself, some miraculous thing will happen. And so I think for these guys, the acupuncture can help again bring back that balance to the body. It can give them strength. It can help their appetite. It can help their muscle atrophy. It can help neurological conditions big time. I mean, I've used it, I've kept animals from having to go for discs or herniation surgery. I've cured cruciate ligament ruptures with acupuncture without having to go to surgery.
Oh, that's fantastic.
So it very, very much, and it's not going to cause any harm, and it's not going to cause any more disruption to the body either. So I just got a dog. Oh, he's this giant Labradoodle, and the first time I saw this dog, I didn't think he was going to make it, and she didn't tell me they'd given Librela until I was halfway through the physical exam, and then she said, "Oh, by the way, my vet gave these injections," and I said, "Well, how many did he get?" And there were three. The dog could barely stand up and didn't want to come off of his dog bed, and
Oh,
three acupuncture treatments. I went over to their house and he came running out of their bedroom to me at the front door. So he's like back to normal now, and they're so thankful. So it's worth it to search it out. You can do a whole lot of acupuncture treatments for the cost of one MRI. And
excellent.
and you don't have to have the imaging for the acupuncture to use it or for it to be helpful either.
Ah,
So
okay.
people need to understand that a good acupuncturist can just look at that animal and palpate that animal and treat that animal without more expensive imaging.
My pet has extreme weight loss and muscle waste. What can I do?
This is, I mean, I think the weight loss may be from partially the muscle wasting, and if they're not eating. The muscle wasting that people are seeing, I think, also goes back to the neurological, the nerves being blocked.
Yeah.
Because if those nerves, with muscle, if you don't use it, you lose it. And if there isn't nerve stimulation going to that muscle to stimulate it to contract, because the nerves
Ah,
are what causes the muscles to contract, the muscle is not going to contract, and those fibers are just going to whittle away and dissolve in front of your eyes. So for that, I don't, it's really tough to say. Getting the nerve growth factor back in there as much as possible. Seeing if you can do some rehab and exercises so that the muscles are contracting, even passive range of motion type things, working with somebody who does rehab, keeping them up and walking, making them walk. That's what I do with a degenerative myelopathy. The acupuncture may help with that, especially electroacupuncture, because it can stimulate the muscle contraction and can stimulate the nerves. So that might be another option as well.
yes. For, again, I'm in the position of representing our pet parents here, so I'm going to relay my experience with the extreme weight loss for my dog was one of the first indicators that something was really wrong that we missed. And
Mm,
he was still eating his normal intake of food at that time, but yet
mhm.
lost 2 pounds. So for a dog that's healthy weight is 18 pounds, 2 pounds is a big deal.
Yeah.
Um, but he was still taking in all of his normal amount of food. And I just, as far as the connecting the dots, what's happening is this related to this injection? It was, and it was missed until the muscle wasting and the weight loss
Hmm.
never stopped. The weight loss never stopped, even though I made sure he
Wow.
got at least 2 meals a day, even if not of his own volition. I would syringe feed him, and the weight loss never stopped. It just
Wow.
so it was
There's
confirming for the pet parents what you're watching happen to your dog. This is very real.
And that makes me wonder, there is something called cachexia, which is just severe weight loss and muscle wasting. And we see it with cardiac cases and with
Mm,
cancer patients. And that's what you are describing. The first thing that comes to my mind is some type of cachexia going on. So, and it might be multifactorial. Again,
yeah,
we're
yeah,
dealing with something that's so much bigger than one simple thing.
exactly. Is this recoverable? Is this survivable? And will there be permanent damage? Um, one of the worst parts for us pet parents of this experience is no one can tell us.
Yep.
No one can tell us when, how, or even if our pet is going to recover.
Yeah.
That's really scary. But the possibility exists. Just as no one can tell us whether they will recover, neither can they tell us they won't. Therefore, we keep trying. We try
Yeah.
and we try and we try until our pets either recover, which you described the Labradoodle who made a
Yeah, I
recovery.
mean, yeah,
We have,
there is some
yeah,
hope. I mean, it was so like I'm like, oh my God, yeah, yeah. But you gotta at least try again until your pet says no, and they'll let you know when they're just done.
they will. This
Yeah,
this experience taught me the very distinct difference between I don't feel well and I am dying. I now know distinctly what
yeah,
the difference is between those. So your pet will tell you, and there will be days of great improvement. You'll be like,
hmm,
okay, we're
hmm,
on the road to recovery. You're having a good day, followed by a string of very, setback days. So anybody in the process of trying to help their dog recover from this know that it is a two steps forward, three steps back, and it's not linear by any stretch of the imagination. It is all
yeah,
over the place, and so you got to be attuned to your pet and try until they tell you they won't anymore. But there
yeah,
are recovery stories. There are
yeah,
many recovery stories. I do not want to take hope away from anyone because
yeah.
you got to cling to that while you're in the middle of this.
Yeah, there's another case. One of the first cases that came to me and she let the dog out to go to the bathroom and went to get it in and totally paralyzed, dragging his back legs, coming back in. But he is up and walking. He's not as strong as he was, but they are like plodding along. So yeah, you have to try and just sharing stories too helps. And it's a roller coaster, with any kind of, it's like the same roller coaster with any kind of chronic disease. And I always tell you people before, unless if you get the message from them, then that's it, if they're going downhill, sometimes my rule of thumb over the years has been to give it 12 to 24 hours, and they're either going to keep on going down. If they keep on going downhill and don't show improvement, then it may be time, but sometimes just see what happens when the sun rises in the morning.
All right. A very, well, I consider it a big topic. It has been a big topic of discussion amongst the pet parents, which is how do I talk to my vet about this? We've had a lot of reactions and responses from veterinarians that are shared by the pet parents that include not only a denial that Librela is the cause, but often an outright dismissal. And
Yeah.
the result of that is they go looking for some other cause and may inadvertently make everything worse. This part of the experience has to be acknowledged. First of all, it is happening. If this happened between you pet parent and your vet, you're not crazy. These conversations are occurring. I don't want to dissect why the vets are having that response unless you want to speak to that, but I do want to confirm and validate this is happening between the vets and the pet parents.
The vets, this is happening. And I had it happen. I was teaching a small group of veterinarians acupuncture with 5 vets, and I had it happen between me and these 5 veterinarians. And these were just veterinarians in the same room. And I think what's happening is the vets are being squeezed in between what the corporation is, believing everything the corporation and being assured by them that there's no side effects, giving these things and then having these animals come back into them. And what they are doing, I think the vets who are denying it, they're taking the guilt on themselves. Like, I caused this because I injected this into this animal. And I don't care. Any veterinarian is not going to want to think that they caused harm to an animal. And so I think the guilt factor is what's coming in there. So one thing, I mean, it's horrible, especially if you have limited veterinary care wherever you live. Sometimes you have to work with the vet that you have. So to go in and say, listen, maybe not even develop a relationship with them, try to keep blame pointing finger out of it as much as possible. And I know being angry and upset and panicked and everything, but to say, listen, focus on what signs you're seeing from your pet. My pet isn't eating, this is going on, that's going on, and try to get the vet to focus on those things, to try to help those things. And then have backup material like what we have on this website and such. Because if you go in the Librela screaming, a lot of them are just gonna crawl under the table and not gonna want to do anything at all. And that's what's happening. And they're gaslighting them. And the company's throwing the veterinarians under the bus on this, in my opinion.
Yeah.
And it's breaking. I mean, veterinary medicine, the reason I went into it instead of human medicine is because the veterinarian was still the family doctor. You got to know your clients. I will go to my clients' houses. I know their kids. I watch their kids grow up. I take care of generations of animals for them. And that's why I wanted to go into this. The trust between people and veterinarians is completely being broken. It was already harmed before Librela came around, and now it's being completely broken. And that really sucks because who suffers the most on that are the animals. And our
Yes.
domestic animals depend upon us to take care of them. So we have got to figure this out. And like I was speaking to these young vets and I said, I mentioned the website that this website we have put up and the grief
Right.
video in there. And one of the veterinarians said, well, how can we send them to this website? Because it's going to be admitting that we gave them something that harmed their animal. And so that's part of that guilt thing that's behind it. So what you might even preface it with your veterinarian is going in saying, I know you received information from the company that may not have been fully truthful. And I know you did not aim to harm my animal, but now we're dealing with this set of circumstances, and I would really like your help to move through this. Kind of address it on the front end so it relieves them of that guilt and the horrible feeling that, oh my God, this may be happening because of what I did. And so it might help that way. The other, and I told the veterinarian who said that, it made me see the whole picture too. And I followed it up with, I said, maybe you need to start thinking about using this medication. If you're seeing animals coming in harmed by it, maybe you better start thinking differently about it. And the problem is also is the corporatization of veterinary medicine because clinics are being bought out, scrambled up. And I will tell you straight up, veterinarians are not learning what I learned in veterinary school. They're teaching them to refer to specialists. So they don't even have I don't know, like a half the knowledge that other veterinarians from older generations had when they got out of school. They're being really squeezed between a rock and a hard place, and they're being told what they can prescribe and what they can't prescribe. So some of these vets, when they say this is all we have to give to your animal, they might not have non-steroidal anti-inflammatories sitting on the shelf anymore. So yeah, because it's a crazy situation we find ourselves in right now.
It has been. This was an element of the Twilight Zone uh
Yeah.
sensation of this experience was these interactions with a number of veterinarians for people not understanding this and that breach of trust. That breach of trust has
Yeah.
been severe.
I don't know if it's repairable. I don't know what's going to happen,
Right.
honestly. I really
And
don't
for
know what's going to happen.
and for a number of people who did have a family vet who they had for many years and this occurred, you want to be able to have those conversations with them, but then so you give them the grace of, I trusted
Hmm.
the vet trusted the source that they received this information from. And so, definitely give them that grace because that is what happened
It
here.
it might open up the door because honestly, I can't think of any veterinarians who would have gone into this without truly wanting to help animals. So
Exactly.
try to tap into that. I've had holistic vets who are very, very well known in the community use this, and I've seen some of their patients, and I'm just like, what are you doing? It's blowing my mind. And this is also shows us the power of marketing and the power of like literally brainwashing. I don't know any other way to put it.
And the other part of this about talking to your vets, we're not, this doesn't exist in a vacuum. The facts and the
Yes.
data are out there. This product was new here in the United States in October of 23, so just months ago. But many other countries had it prior to the US. The data exists. What the results and the outcomes were of thousands of cases prior to the drug even entering the US market exists. So if pet
Yeah,
parents can find it, oh, sorry about that. I
and
need to go.
we have the data on this website. I mean, there's an incredible team of statisticians, professional statisticians who have gone in and organized this data so professionals from scientists to veterinarians and to pet owners can really look at it and see the numbers. So it can't, numbers don't lie, right? And numbers don't lie, especially with quote unquote scientists and real science, which, science is under attack in and of itself these days, unfortunately.
To number 10 of our pet parent questions. Okay, you've educated me on Librela. My dog survived it, or I chose not to give it because we do have those wonderful people who are lucky enough to research this before giving it to their pet. So, all right, I've ruled out Librela as an option for my dog. What are the other treatments for my pet's osteoarthritis?
There are so many different other treatments for arthritis. There is, first off, not an anti-inflammatory diet, which everybody's screaming up about for people as well. Bone broth, good old homemade bone broth. If you can't make it, you can buy it. There was a study done that showed a force plate analysis pain study that showed the type 2 collagen in bone broth was effective as a non-steroidal anti-inflammatory for arthritis pain. So your mother, your grandmother's chicken bone broth, or the turkey carcass that you cook up after Thanksgiving, and again, if you can't make it yourself, there are lots of companies selling it now for animals. And then we have non-steroidal anti-inflammatories. There are numerous herbal formulas, Chinese formulas, other formulas. Chinese medicine has goodness, there's probably 10 to 12 or more different formulas, herbal formulas that you can give for arthritis pain. I have a 14-year-old German Shepherd Husky mix. I diagnosed her with horrendous hip dysplasia when she was 3 years old. She's 14. She's jumping in the back of my Forerunner. She's not, she is on occasional NSAIDs. She's on Chinese herbs. She's on a good diet. She's on exercise, rehab, acupuncture, electroacupuncture, red light therapy. There's EMF mats. There is TENS units. I mean, there's numerous things for arthritis. And even doing rehab for your dog, you don't necessarily have to go to an expensive rehab person. You can look at videos online on YouTube. I walk her through the park and make her step over those cement parking things. I make her walk up and down hills and sideways on hills. There's lots of things you can do without spending a ton of money that can help them.
Look at that. We've reached the end of our top 10 list. Super, super informative. Thank you so much for your time and your expertise, making yourself available for this conversation. We've mentioned the website a few times in our conversation, and we'll do so again here because a lot of what we've talked about is available there, thankfully.
Yes.
And you're available for consultations. Is that correct?
Yes, that's correct. I am going to be coming out with I'm getting my website updated, but you can also private message me on Facebook. But I am giving a discounted price to the Librela cases just because I know what you guys are going through.
Oh, thank
So,
you.
yeah. So people can definitely contact me about that, and I can guide you in specific dosages and what I think is going to maybe help your individual animal. So, yeah.
Beautiful.
Yeah.
All right. Well, I feel like we thank you. Completed our mission on behalf of the pet parents today and the pets
Yes.
obviously. And
Yes.
if we spare anyone, any individual from this experience, we've done something good.
Yeah, and I know you've gone through it, Rhonda, with your own pets. So I mean, thank you for stepping forward and all the volunteers for this website. My goodness, it
The
wouldn't.
entire team, yeah, they made this available, put all this content together for us to
Yes.
guide this conversation. Just super informative and helpful.
Yeah.
All
So thank
right.
you.
Thank you,
Good luck,
Dr.
everybody.
Josie.
You're welcome.
Good
Take care.
afternoon.